All right, we're going to look at the drugs affecting the reproductive system. I should clarify, we're going to look at some of the drugs affecting the reproductive system because there are quite a few. So in general, typically why are we looking at using reproductive drugs for animals? Could be to control the estrous cycles for artificial insemination, timed parturition dates, so timed birth dates for ease of facilitation and seasonal concerns, prevent pregnancy in dogs and cats, sterilization in dogs and cats, to assist in the expulsion of pyometra contents, reduce the size of cysts in the reproductive organs, etc., etc., etc. But most often, we're looking at using these drugs as a method for synchronizing cycles with large breeding operations, such as cattle or equine breeding operations. So looking at hormone drugs, either natural or synthetic, most often we're using them in food animals and horses to synchronize those cycles, as I mentioned, maybe to terminate pregnancies and to induce ovulation. I'm just going to go back. So picture the amount of cattle here, and let's just assume that they're all breeding cattle. So looking at the first two, looking at controlling of the estrous cycles for AI, and then also the timed parturition dates, so the timed birthing dates. The key here is to make it an easy process. So if you have this many cattle or more, let's say you have a couple hundred head of cattle, and even if you breed, 25 of them at the same time, you want to ensure that you, of course, have the staff on at the time that the cows are going to give birth. You want to ensure that you have all the equipment ready and that everybody's on high alert. So if the owners or the farmers are able to control those estrous cycles and plan for birthing at the same time between different cattle, then at least at that point they can definitely, control some of the variables. They can have staff on hand who are able to assist in parturition. Maybe they are going to plan them so that they're not in the dead of winter, etc., etc. So for best outcomes and for management. For dogs and cats, we don't see it used, we don't see reproductive drugs used too often in dogs and cats. Typically, they're used as a form of sterilization or birth control, and I'll talk about them at the end because your textbook doesn't have a lot about them, but there are some new and upcoming methods for this. All right, so using hormone-based drugs for reproductive measures, it's always going to depend, which drug you choose is going to be dependent on the phase of the estrous cycle. That being said, they also have to be appropriate for that animal and safe for that animal. But looking at the phase of the estrous cycle, these individual drugs can either be super effective, they could be completely ineffective, they could be indicated or contraindicated, all dependent just on the phase of the animal cycle, because a lot of them work with specific hormones or specific phases. So if they're given out of line, they'll either have no impact or a detrimental impact. So then they tend to divide up the estrous phase into two separate sections. So we have the first part, the follicular phase, which is focused on the hormones produced by the ovarian follicle when they exert predominant control. So this is typically the proestrus and estrus phases that we're looking at. And we're talking about gonadotropin-releasing hormone, follicle-stimulating hormone, estrogen, and then that leads to that LH peak. So if you think back to anatomy and physiology and that the dips and peaks in hormones in the estrous cycle, the first phase, so proestrus and estrus, we're talking about the follicular phase. The second phase is the luteal phase, and these are the hormones of the corpus luteum on the ovary. So it's when, the hormones of the corpus luteum predominate on the ovary. So looking at this, typically we're talking about diestrus, aka metestrus. Just depends. Some people call it metestrus, some people call it diestrus. But essentially it's that phase right after estrus. And the main hormone here that we're focused on is progesterone. So of course, like anything with the endocrine system, it's all working back on a negative feedback loop for the brain to identify which hormones are in low quantities and which hormones are in abundance. So we'll start by looking at gonadotropin-releasing hormone synthetic analogues. Lots of wonderful big words there. So GnRH is the short form of gonadotropin-releasing hormone, and it is from the hypothalamus. It stimulates the pituitary gland to release follicle-stimulating hormone, and then the follicle-stimulating hormone causes the ovary to produce follicles, which contain the oocysts, the eggs. The follicular tissue also produces estrogens too, and it results in behavioral and physical changes associated with estrus. So when we're looking at this cascade, if we flip back to the follicular phase, we've got the hypothalamus with the gonadotropin releasing hormone through the pituitary gland and so forth. You can see that continuous cascade of hormone release. So looking at drugs that mimic gonadotropin releasing hormones, they're also called gonadorelins, which I don't know why, but gonadorelins, I find a really interesting name. It reminds me of gremlins. Apologize. I giggle every time I think of it. So in general, we can't really mimic perfectly the natural gonadotropin releasing hormone effect because we can't administer it in pulses. So in the body, GnRH doesn't just get surges the way the luteinizing hormone gets surges and the way progesterone is a continuous. GnRH ends up being released in pulses and it has effects on the body through those pulses. So they can't quite completely mimic them, but they try. And the gonadorelins are sort of the best example of mimicking those hormones. Gonadorelins are approved for short-term use in beef and dairy cattle to lyse or break down persistent ovarian follicles or follicular cysts through stimulation of luteinizing hormone release. They also can be used as part of a protocol to sync estrous cycles in cattle. So when the luteinizing hormone happens, it causes lysis of the follicle, so it releases the egg. So of course, if that's the case, if the animal has persistent follicular cysts, then that luteinizing hormone peak will help to break down those cysts, and it's actually quite effective for that purpose. And then we have the term gonadotropins. They're not the same as gonadorelins, but are drugs that are very, very similar in general to FSH and luteinizing hormone. So they produce their effects on the gonads. In general, gonadotropins might be used to induce superovulation, so releasing of multiple eggs, or to induce estrus in the dog or cat. Sometimes they can be used in a cryptorchid animal to help that testicle to descend. But in general, the main thing you need to know is that gonadotropins are not readily used in veterinary medicine. More likely you're going to see gonadorelins. So again, gonadorelins, they mimic GnRH, which of course down the cascade stimulates FSH and LH to be produced, whereas gonadotropins are actually pretending to be FSH and LH. Okay, moving on, we have progestins, progestagens, and progestational hormones. So a little bit of terminology here. Progestagen is a synthesized drug that mimics progestins, and progestin-based drugs generally have the fragment gest within them. So examples, of course, we have altrunagest, which is also known as Regu-Mate, and medroxyprogesterone, which is known as Depo-Provera, which you might be familiar with if you are a female and you've ever been on Depo-Provera as an injectable birth control format. So progestin drugs are commonly used in horses and production animals to extend that luteal phase. And they might also be used during the follicular phase to slow or halt the progression of estrous cycle through the inhibition of release of gonadotropin-releasing hormone, FSH, and LH. So in general, it's going to slow the development of the follicles. When it's used in the luteal phase, what we're talking about is prolonging diestrus. And reasons for prolonging diestrus, very similar to the same reasons for slowing or halting the estrous cycle. It's just on either end, either before estrus or after estrus. The goal here again is to slow it down and then administer drugs after that to set them into estrus or set them into that ovulation phase so that they can be matched up and synced with their counterparts, so with their other cattle, with their other horses, etc. So also your textbook notes progestin for foal heat. So sometimes mares that go into heat sometimes mares go into heat, soon after parturition, so just after they've had their foal. And this reduces the likelihood of future conception. So they've had studies that correlate a mare going into a heat, very quickly after her parturition of a foal, with future conception. So with that first breeding after, she has a less likelihood of keeping or maintaining the pregnancy. So there is some debate. Some people suggest that we can treat with a progestin to halt the progression of the estrous cycle. However, the other line of thought is that we allow the heat to go through the heat cycle and not get bred, and that the results, it's comparable, the results. So that's debatable. It's something that you might see, do they give the progestin-based drug or do they not, just after the mare's, gone into heat after a foal? Just be aware of it. It's acceptable on either side currently. And then we do have to take caution with long-term use of progestin drugs. So progesterone overall causes this nice ideal environment for implantation of the egg after fertilization. So what we're looking at when an animal is on progesterone, of course, it's going to mimic that post-estrus phase in the body, so prepping the body for pregnancy. So what will start to happen, they get these milky secretions in their uterus, and they call it uterine milk, which makes me want to barf. Saying it out loud, I don't know why, I just get the grossest image. I picture a pyometra. That's exactly what it is. So unfortunately, this, warm, milky, moist environment that is created to support a fetus is also a really great environment for bacteria, and bacteria love warm, moist environments. So with that long-term use, we have to be very cautious because the animal could, of course, get a pyometra. They're at a higher risk of pyometra. And of course, in case you don't remember, I had to throw in a visual, but this is a dog with a massive pyometra. So that's a uterus. We've got the ovaries right there and a clamp. And then we've got one uterine horn and then the second uterine horn. Massive, massive, massive. Freaking ridiculous. And then, of course, there's a difference between an open versus closed pyometra. And then depending on the species, they might need surgery, antibiotics, draining, etc., depending if it's opened or closed. So again, just a refresher, closed pyometra means that the uterus is infected with pus and the cervix is closed, so you don't see any discharge coming from the vulva. Open pyometra, the cervix is still open, which is actually better for the animal, and you can see the pus. And the way I picture it, if it's a closed pyometra, then that pus is really festering in the uterus and has no way out. Whereas if it's an open pyometra, sometimes we can get away with just treating them with antibiotics because some of that pus is allowed to escape. So gross, but interesting. Okay. More cautions with progestin-based drugs. So there is also potential that with long-term use, we can get uterine hyperplasia. So that's an increase in the growth of the uterus, the growth in the uterine tissue, Changes in hair coat. So this could be hair loss, could be discoloration. Could be an increased incidence of mammary tumors, increased sodium and water retention, lethargy, and weight gain. And cats, the risks are always greater than the benefits. Cats are special. Don't ever forget it. And then there's even more cautions. I think I have 3 slides of cautions, so just don't get your knickers in a knot quite yet. So antagonist effect on insulin. So with long-term use or even just in general, high dose use of progestins, these progestins have an antagonistic effect on insulin. So it reduces the insulin's ability to take the glucose from the blood and put it into the tissue cells. So that means that the tissue in the body is not getting glucose. It's not able to use glucose. And instead, of course, the blood has a ton of glucose and the urine has a ton of glucose. So that essentially is diabetes. So it has this antagonistic effect on insulin, which could be a temporary diabetes. But as long as they're on the drug, it's definitely going to maintain itself. And just as a side note, this is also why pregnant women and some other mammalian species are at higher risk of developing this thing called gestational diabetes. And it's because of the effects of progesterone on the body with its antagonistic effect on insulin. Also could cause cystic endometriosis. So endometrium is, of course, the innermost lining of the uterus. And long-term use can cause permanent change to this lining, results in subsequent infertility. And it also can cause mammary gland proliferation, which increases the chances of mammary gland tumors, which I think I mentioned on the last slide. Okay, I guess I only had 2 slides of badness. Okay, so I'm going to work through some examples of progestin drugs. So Regu-Mate is the one that you'll most often come into contact with, and it's on label for horses. Altrenogest is its generic name. So it's an oral dose for equine, and it regulates the onset of heat cycles, and it avoids heat during a competition. So this one, I think this one's also in your reading guide quiz, so I won't necessarily go through it in super detail. Well, I will, just in case you're not doing the reading guide. But essentially, a lot of times this one's used if an animal might be competing. So we want to avoid the mares going into heat if they're in the middle of a competition, or if they're going to be shown where there might be stallions present. Because of course, if we bring an in-heat mare where stallions are, then that can be a very dangerous situation for the horses and for the handlers as well. One thing to note, very important, is that this drug is easily absorbed through the skin, and we have to be very cautious of that. So Regu-Mate, in general, the warnings for Regu-Mate, people with the following conditions should not handle this drug. So women who are or suspect they are pregnant, because remember that is going to alter the amount of hormones in the body, or sort of the effects of the hormones in the body. People with a history of thrombophlebitis, so inflammation and clots of blood vessels, or thromboembolic disorders. People with cerebrovascular or coronary artery disease, women with carcinoma of the breast, people with known estrogen-dependent neoplasia, women with undiagnosed vaginal bleeding, and people who have developed any type of tumor while taking oral contraception or estrogen-containing products. So the reason for this, of course, is because we're adding potentially something that mimics progesterone into the body. And of course, that can completely screw up cycles. So female cycles, if a female is pregnant and then they suddenly get too much progesterone, that's a problem. But also when we administer progesterone, regardless of the fact that it's ideally just progesterone, it's also going to trigger essentially an increase in estrogen as well. So with that, a lot of these have effects on estrogen. I'm trying to say this properly. Estrogen can affect a lot of these specific conditions. And that being said, with these specific conditions, we don't want to increase the levels of estrogen in the body. I'll say that 6 times fast. So Regu-Mate has a lot of warnings and cautions. So the main thing here is, as the RVT, you need to be very, very careful about using this medication with your patient. But also, it's extremely important to discuss this with the client so that they don't get into trouble with the medication as well. Always, always use gloves when working with this medication. And of course, if you're in that high-risk category, just avoid the drug altogether. And then, of course, avoid accidental exposure. So more progestin drugs, we have NGA, which is melengestrol acetate, and this one's on label for bovine in this form. I'll talk about another one. And it's known as a feed additive to disrupt the estrous cycle. And then a couple other, so we've got melengestrol acetate again, so MGA. MGA was also on label as this drug called Ovaban for dogs. And it was a progesterone-controlled internal drug release apparatus. So it provides a continuous supply of progesterone. So this is something that was implanted, and it would control this or release this continuous amount of progesterone. So this product is no longer available, at least in Canada, and I don't think it is in the States either. So it just depends on which country you're working in. It may or may not be available. And then megestrol acetate is an orally administered progestin used for contraception in female dogs and cats. So again, this one is not available here in Canada as far as I know. I don't know if it's available in any areas of the States. It definitely can have some serious risks when it comes to feline use, especially. So in cats, profound adrenocortical suppression. So then they get essentially Addison's disease. They can get adrenal atrophy, polydipsia, polyuria, personality changes, and possible hepatotoxicity. I'm just going to say what doesn't cause hepatotoxicity in cats. And then the risks versus the benefits, they have to be continuously reviewed. And sometimes when it is in use for dogs and cats, it might be viewed as a stopgap measure. So it's not available for us here in Canada. As far as I know, that could always change. But I did find this neat little information website here. So this is the Alliance for Contraception in Dogs and Cats. And it's always good just to check out these kind of associations because sometimes they are able to acquire data and studies before the big companies are able to release data and studies. So this was a survey that they had. Take our survey on Megestrol acetate. So their question is, have you considered using or prescribing Megestrol acetate as a contraceptive option for cats during the pandemic? If so, we'd like to hear from you. So what it goes on to say is that, it's not currently recommended or supported necessarily to be used widely. However, during our weird year of 2020, so many cats and dogs were put on hold from getting spayed or neutered. So it looks like in the States, some vets were able to prescribe this drug, Megestrol acetate, to help prevent those estrous cycles from occurring. So it's kind of interesting. Like I said, a stopgap measure. Again, as far as I know, it's not available in Canada. I could be wrong because those things change all the time. But it is available in some areas of the States, whether it's on label or not. That's probably debatable, and it's actually probably unlikely. But interesting, eh? It's just interesting that when we can't get them fixed, spayed or neutered, then of course we have to look at stopgap measures. Okay, so then we also have progestin drugs that are administered as a CIDR or a controlled internal drug release. And mainly we have one for cattle that's inserted vaginally, kind of like a IUD, like a hormonal intrauterine device, but it doesn't technically go all the way up into the uterus, just into the vaginal canal, and it allows for continuous release of progestin drugs. So moving on, we're going to talk about estrogen drugs. And in general, estrogen drugs are not really used for reproductive purposes in our field anymore. And the reasons for this, there are a ton of side effects, some resulting in the banning of these drugs. So we'll talk about them to give them a nod that they existed at one period of time, and you may come across them. Who knows? People may still have them if they have a feedlot or, like I don't know. You never know what people have. So historically, these drugs were used for many reproductive and non-reproductive purposes. Lots of side effects, sometimes led to banning. And in general, there's lots of safer products on the market, so we don't typically use them. So the ones that you'll come into contact with are estradiol, or you'll hear of estradiol and estriol, as well as diethylstilbestrol. So we tend to call this one just stilbestrol. And this one in particular, stilbestrol, was in use widely for most of my career. And I just noticed, this is how much I pay attention day to day, but I only just noticed that it's really on its way out. And it may not even be, I believe it's sort of, I feel like it's not even available now unless it's from a compounding pharmacy, but don't quote me on that. So this one in particular, stilbestrol, and it used to be an estradiol as well. They were primarily used in spayed female dogs to treat urinary incontinence. And they're found, unfortunately, to have significant carcinogenic effects to human beings. So the drug was banned from use in food animals. I'm stumbling on my words there. So estradiol was used at one point for cattle quite readily. They used it a lot in regard to reproductive status, so in altering the reproductive cycles. And then it also is used to a point in dogs for urinary incontinence, but specifically stilbestrol definitely was used in dogs for urinary incontinence. So the key things to pick up here is that, stilbestrol is not really used as part of the reproductive cycle. Estradiol used to be used quite readily in cattle, but it was super carcinogenic to people. So they had to cancel it for use in food-producing animals as a bare minimum. So going back a little bit of the topic of urinary incontinence, just while we're on this topic, I think it's important for you guys to know about this because it's a very common challenge in small animal medicine. So urinary incontinence in general for female dogs, after we spay them, after we remove the ovaries, then the estrogen decreases significantly. And this results in poor closure of the urinary sphincter. So that is why we tend to see a lot of normally young to middle age, larger dogs with urinary incontinence that started anywhere from about 6 weeks to a couple years after they were spayed. So the medication that we give for this are estrogen, ones that mimic estrogen, such as stilbestrol. And if we're using stilbestrol, we use it in higher doses at first as a loading dose, and then we want to wean them down to once weekly dosing because there are a lot of potential side effects for the dog. The other one that is much, much safer and much more widely used now is phenylpropanolamine, and that one is an alpha adrenergic agonist. So that one, the downside is that we give it twice a day, but it's much, much safer. That should say but, not buts. So both will sensitize the sphincter to alpha adrenergic stimulation, which ends up resulting in slight muscle contractions and allowing those sphincters to contract. So overall, looking at the concerns with estrogen-based drugs, there are a lot of them. Overall, estrogen increases the number of progesterone receptors in the uterine cell. And of course, we already talked about this with progesterone type drugs. If we increase the level of progesterone, then we're going to cause those same side effects as the Progestin drugs. So that means increasing that nice environment for the fetus, which means that uterine milk, barf, that uterine milk that is produced, which of course can result in a pyometra. And then normal doses can cause suppression of blood cell production in the bone marrow. And we could be looking at aplastic anemia. And of course, signs of aplastic anemia, we've got a decreased platelet count. We have petechia, which is tiny little bruises all over the mucous membranes in the skin. Symptoms of generalized anemia, sometimes it can resolve after discontinuation, but sometimes it can continue and cause death. So these are pretty serious side effects. So again, we are getting away from using estrogen-based drugs, especially in high doses. Goodbye, estrogen. We'll see you later. Okay, speaking of drugs with side effects, let's segue into prostaglandin drugs. So we've talked about prostaglandins before, and we know that prostaglandins in general can have really good and really negative effects on the body. So we already know that, and we're going to keep using that in the back of our mind as we work through prostaglandin drugs. These are drugs that may be used in the luteal phase to lyse the corpus luteum and cause contraction of the uterus. So this is in the phase after the phase of estrus has occurred. So we're using this in diestrus. They have a major role in synchronizing estrous cycles in horses and cattle. And in general, when a drug like Luteolise is given, we'll see the start of a new estrous cycle within 2 to 5 days of injection. So that can be really good in synchronizing your horses or cattle when you're able to administer a drug, and within a few days, you know that they are all starting up a new estrous cycle. In general, when we're talking about prostaglandin drugs, they tend to have prost in the trade name or the generic name. So dinoprost, tromethamine, cloprostanol is Estrumate, etc. Prost or prost, however you want to say it. Prostaglandins can also be used for termination of pregnancy. So dinoprost, tromethamine, Luteolise is the one I was talking about earlier. It's on label for mares, so it's on label for horses. The side effects after literally within minutes of giving it, can be transient tachycardia, so transient meaning it will come and go, and increased respiratory rate. We can get discomfort, sweating, and pyrexia that lasts about an hour. And it's also recommended to be accompanied by misoprostol, which is prostaglandin E. So we're going to administer, ideally, misoprostol as well to help produce those protective effects on the gastrointestinal tract. Because remember, we're administering a prostaglandin, they have effects on tons of areas within the body. Cows are special. So cows can maintain a pregnancy without the corpus luteum. So if we go back here, just refreshing, prostaglandin drugs are drugs that can be used to lyse or break down the corpus luteum. Okay, that's the goal of prostaglandin drugs. But cows can maintain pregnancy without the corpus luteum. So cows, in general, their placenta will start to produce enough progesterone to maintain the pregnancy. So rather than lysing the corpus luteum and stopping that progesterone concentration in the uterus, cows can just simply carry on without the presence of the corpus luteum because their placenta will produce enough progesterone. Prostaglandins, however, can be effective in terminating the pregnancy if the cows are given it before the 4th month of pregnancy, because it's after the 4th month of pregnancy that they start developing those high levels of progesterone from the placenta. Dogs can use prostaglandins after 2 to 4 weeks of pregnancy for termination, and it can cause tachycardia, respiratory distress, vomiting, and diarrhea for about 20 minutes. So just a side note, look at those side effects. Honestly, respiratory distress, vomiting, diarrhea, it's really scary stuff. Tachycardia, we generally avoid this in dogs. So these drugs, prostaglandins, we've talked about prostaglandins before, prostaglandins mean business, and they can be very dangerous drugs. So I just want you to keep that in mind. If we give too much, or if we use them inappropriately, they can be seriously dangerous drugs. So looking at precautions with prostaglandins, like I said, they can affect many, many body systems, and the side effects can include unintended abortions in pregnant animals. So if you give a prostaglandin to an animal to disrupt their estrous cycle and you didn't realize that they were pregnant, then it can cause termination of the pregnancy. It can cause bronchoconstriction in animals with respiratory disease. It can cause vomiting and diarrhea in cats. It's not really used for them anyways. It can cause colic and sweating in horses, so abdominal pain and sweating in horses, and central nervous effects in larger doses. So these are very scary side effects. Precautions. Prostaglandins are easily absorbed through the skin, and they can cause corpus luteum lysis and bronchoconstriction in people as well. So you guys must know this. If you are asthmatic, or if you're planning for pregnancy, or you might be pregnant, stay away from these drugs altogether. Just like misoprostol. We talked about this with misoprostol last semester. Yeah, that was last semester. Yeah, gosh, time flies. In general, if you're working with prostaglandins, if you are childbearing age, stay away from them. Get away from them. Don't touch them. And in particular, if you're asthmatic with these ones, you're going to avoid using them altogether. Everyone else, if you don't fall into the category of asthmatic or pregnant or possibly pregnant, then when you are working with them, you need to wear gloves because you could undergo some of the side effects that horses and cows get. So prostaglandins, you need gloves. Progestins, you need gloves. Those are 2 pieces of information that you definitely need to know. Moving on to oxytocin. It's an endogenous hormone from pituitary that causes contraction of the myometrium, so of the muscle layer of the uterus. And it can be given during parturition, and it can also be given after parturition to assist with expulsion of the placental materials. So there's debate with use of oxytocin. So the times that we give it for an animal that is in labor during parturition is if they're undergoing dystocia, so they're having difficulty with labor and they're generally getting fatigued. So if their uterine muscles are fatigued and they're no longer able to push, then we could administer oxytocin to help increase the strength of the contractions. It is a little bit controversial though. There's debate as to whether or not it's as effective as we used to think it is. One note about oxytocin, it will cause milk letdown as well. So we have to keep that in mind. If we're giving it during parturition, then the animal will start to expel their milk. So they're going to be expelling colostrum, which is that first super nutritious, super important, super antibody rich milk for the little neonates. But we also have administered it in animals who are post-parturition, not only to assist with expulsion of the placental materials, but also to encourage milk letdown. So if they're not getting stimulated enough by their puppies or kittens, then we can give some oxytocin to help that milk come down. Okay, so then these are ones that are not discussed in your textbook necessarily, but I think are really important. So we talked all about the females, right? It's all about the females, the book says. But in reality, there's also options for males as well. So deslorelin is a gonadotropin-releasing hormone agonist for use in male dogs. And it causes reduction in testosterone, which of course, if they don't have enough testosterone, then they're going to become infertile. And this is a slow release implant that's administered under the skin. And it's effective. They say that the testosterone starts to drop within 2 to 3 weeks, but realistically, it's fully effective as the dog is infertile within 6 weeks. So after 6 weeks, the dog is considered infertile. So like I said, it's slow release and it has a prolonged effect. It's effective for up to 60 weeks in dogs and 6 months to 24 months in cats. So you can see with cats, it's really variable. And of course, cats aren't small dogs. Cats are sneaky. They're special. But cats, 6 to 24 months in cats, that's really hard to monitor to know if it's still effective. It is nice because you can take out the implant if the animal's having a negative side effect associated with it. So this is something I have to check. I don't know that it's necessarily available in Canada, but they do use it on a lot of, or in a lot of areas where overpopulation is a major concern, and they simply don't have the means to produce a spay-neuter clinic. So it is a potential option. It does come with some side effects, but it is a potential option. And carrying on with male sterilants, we have zinc gluconate, also known as Stericyl and Testoblock, which of course I love that name. And it's a drug that's administered directly into the testicles of dogs and cats. And it causes cell necrosis and scarring of the epididymis and the seminiferous tubules. So if we give this treatment before puberty, the animal never becomes sterile. And if we give this treatment after puberty, it takes about 6 weeks to fully kick in. It's often combined with DMSO to help increase that saturation into tissues, and it has a 3 to 4% rate of tissue necrosis at the injection site. Otherwise, it has limited side effects. And I'm just going to zip to, so where it says click here is a nice little hyperlink, which you guys can look up in your PowerPoint versions if you have them at home. So this is the Alliance for Contraception in Dogs and Cats. I think I had referred to it earlier for another area. So this is a continuous, again, it's an association that's looking at options for controlling the population of dogs and cats. So this one was a 2013 study, and it has all the different options available, who they're used from, or who they're used for, where they're available, side effects, etc. So it's kind of a very cool opportunity to look into that if you're looking into, regulating population control as part of your career. So looking into the future, we're always looking at the risks versus the benefits associated with all of these reproductive drugs. Sterilization, so looking at surgical sterilization, it has risks, right? It's a surgery, so it's going to have some risks compared, and we have to compare those risks to medical sterilants. Current research is starting to favor chemical sterilants over surgery in many instances, and I don't necessarily mean for your owned dog or cat that you bring to the vet clinic, but I might be talking about those remote communities who don't have access to veterinary care. So it's important as an RVT that you always stay up to date on current trends of reproductive drugs, especially for food and production animals. So if it's an animal, of course, that you're treating and they produce meat or they produce milk, you guys need to know 100% what you're administering and if it's safe and if it's on label for that animal. And then I thought I would end just with a nice little picture of this community. It's called Pond Inlet, and it's located on Baffin Island up in Nunavut. It's the most northern place I've been in my life. It's within the Arctic Circle, and it is a fabulous, beautiful community. And I went there back in 2008 to work to provide spay and neuter clinic for the community. And it's in these types of communities, like a lot of those northern remote communities, where we are starting to look at introducing some of those reproductive medications for dogs and cats. Cats, really, there aren't too many cats up in this type of area, but looking at introducing or at least reviewing the need for chemical sterilants compared to surgical sterilant as an option, as something that is simply available for people to work with population control. But beautiful area. If you ever can go to Nunavut, or if you're invited to go to Nunavut, take that offer. All right, and that is all.